Hello, everyone. I'm Natalie Kunzman, MD. And what exactly is the problem with RSV? And what is RSV? Well, it is a respiratory syncytial virus, so we call it RSV. And it is a virus that causes mild cold like symptoms for the average person, and you may recover in a week or two. But for the severely compromised or very young or very old, this could actually cause inflammation of the bronchial tubes called a bronchiolitis or a pneumonia, which is an infection of the lungs and is something that comes around every single season. Now, I've had a lot of questions of this virus lately, mostly because we have another virus we have been contending with, but I dare say RSV has a track record in some of our youngsters, especially those that have some underlying reactive airways disease, that it can actually be dangerous for these youngsters. And what do I mean by that? Well, let's get back to how it is transmitted. So RSV is a respiratory spread, so respiratory particulates is one of the most common ways that it is transmitted. And again, the viral droplets can get in the cough, sneeze, mucosa, eyes or nose, and if you touch a surface that has the virus on it and then touch it to your face, it can go through your respiratory mucosa, and in that regard, you can contract it. Now, those people who are at the highest risk, as I've mentioned, are premature infants because their lungs are underdeveloped, young children that have congenital heart or chronic lung troubles, young children that have a compromised immune system or a weakened immune system from any type of medical treatment they're on or the underlying condition itself, or the adults that may have a compromised immune system, such as an underlying heart or lung problem. So now we know how it is transmitted. And again, I need to warn you, this is something that will come around every cold and flu season. Some of the common symptoms are going to be obvious to you, but this would be the runny nose, a feeling of malaise or fatigue, decreased appetite, and then of course you have some of those upper and lower respiratory symptoms such as the coughing, sneezing, fever, or maybe even wheezing or chest tightness and lower oxygen. So in the severely affected infants who contract a bronchiolitis or a pneumonia, this may actually require hospitalization, and the treatment for this virus is somewhat unique in that we use nebulized racemic epinephrine to help control this, keep the lungs open, and keep that child oxygenating until this virus passes. Now, why do I say until this virus passes? Well, there's not a whole lot of antiviral treatments except for Synagis that has been manufactured for several years, which is a monoclonal antibody, which you can give to the severely compromised preemie and young infants. Okay, so what is the problem with RSV and vaccination? Well, in the 60s, RSV had a vaccine that was being pioneered, and it was used formalin and was inactivated. And there were a few things that were noticed. A, there were some deaths regarding the vaccine. And B, it wound up causing disease enhancement when people contracted RSV. Now, that was an absolute disaster. So that was in the late 60s, and here we are, 2021, and we still do not have a vaccine against RSV because it, like many viruses, are quite problematic at trying to develop an antibody or a prevention strategy with a virus that requires T cells and innate activation to help control it. So here we go again. We have a virus that circulates every winter, and we still have yet to have an efficacious vaccine that is safe for our youngsters. And I believe we need to learn a lesson with this throughout our history. Again, there's so many other questions you may have regarding RSV. You may subscribe to my channel below. I will answer some of your commentary. And until we meet again, be well.